As a GP, one of the things that we should be doing is delegating work, because we can't do everything ourselves. I found it difficult to find time to have a break. I was getting in quite early in the mornings to try and sort out the lab links and the letters, and then we had the surgeries, and then we had more jobs to do, and then more surgeries, and then afterwards lots more jobs, and eventually sometime late in the evening I'd managed to get home ready to start the same thing again the following day. I believe that's changed significantly since we've made our changes to the practice, and it's been a change for the best.
We started off, we didn't have enough appointments, so we looked at what we needed. We solved the GP problem first, so we put our clinics on earlier and we split them 50% pre-bookable, 50% priority. We recruited an advanced nurse practitioner because we thought that would help the GP workload. Then recruited a second AMP who started a home visiting team, so that then started the home visits. That freed up GP time to see more complex patients.
We've divided the workload up so that we've got prescribing teams, visiting teams, secretarial teams, including PAs for the doctor.
So my duties are going to include history taking, examining patients, ordering and interpreting lab results, diagnosing conditions, managing the patients both long-term and acute.
We had 2 healthcare assistants, and they basically were just used to take blood and do hypertensions. So when Debbie came in, we started to introduce how we could get them involved in helping in diabetic clinics. Just go to the nurse for 20 minutes at the end, which really looked at the medication and how well controlled they were. So you could see that that started to free up nurse time, which allowed them then to look at more complex cases such as diabetics or COPD, with a view that it would reduce hospital admissions.
I'm a healthcare assistant. I do patients' bloods, we do flu jabs, health checks, blood pressures, and I assist in minor surgeries.
I do prescriptions, dealing with patients, synchronising, just so that they don't have to come in on a regular basis. We can just issue 28 days and try and get them all in line. It saves us time, saves patients time, and the pharmacists as well. There was nobody centralised on the prescription team, and that's why we went forward with the role. Tried to listen to the patient's needs as well. Made quite a huge difference on the prescribing side, really. We've changed office, so we are open for patients to come in as well. So if they have any queries, they can actually come into us, and we can meet their needs at that time, and then pass anything through to the GPs or the nurses if we need to.
So the skill mix over probably the last 5 to 7 years of healthcare assistants, upskilling, and now we have the assistant practitioners, has really taken quite a weight off the practice nurse and the AMP's shoulders, and through mentoring they're able to upskill.
Kind of a day in the life of an AP, so it's so varied, it's so true. You still do your phlebotomy, or I could be seeing a patient with learning disability, so we'll do an annual review with a learning disability, mental health. We would be seeing well-controlled diabetics, mainly type 2 I would say. We'd call the newly diagnosed pre-diabetics in and explain to them what the HbA1c result was and their risk of developing type 2 diabetes, give them lifestyle advice, support, refer them the wellbeing programme. We would get them to come back 3 months later and see the progression.
I was deemed to be pre-diabetic. My cholesterol and my sugar levels were dangerously close to the top. In this pre-diabetic programme, I joined the gym. This was recommended to me. We have a programme called the Wellbeing Programme, and it focuses on diet and exercise. So it's been very successful for me.
Every practice is unique. Every practice has its own story to tell, and every practice has its own unique situation that they're starting from. I think here in our own practice, the main thing that I would say is that we've had belief that we can change. Belief that we can do better, less. We can still make a difference. We can make a big difference, and a lot of what we do can be based on our ability to organise and make best use of both the people and the other resources that we have at our practice.